Hey guys, what's going on? Kevin Yates here from yatesperformancetraining.net. So I got a question from, I hope I get the name right. I tend to butcher names a lot, so forgive me if I do, but I think this is from Rana. Rana, you're dealing with sacroiliitis, which is an inflammation of the sacroiliac joints since a car accident 4 months ago. Have some herniations in the lumbar and cervical spine, left-sided scoliosis. Specialist said that your right sacrum is shifted posterior in comparison to your left side, and you have a shorter right leg. Rana is a doctor, but I think it's musculoskeletal kinesiology is not her specialty. And currently she's doing physical therapy, injections, chiropractor care, and she wants to know what specific exercises I would recommend to strengthen the hip complex, the hips. And can she do these during the acute stages of inflammation? Currently, the SI feels like a blowtorch is sitting on it, and it's often unbearable. Okay, so there's a lot going on here with this. And so what I tend to do with these videos is, because there's so much that could be happening, and that affects like what I would have a client do if I had somebody here. There's no black and white answer where I could say, hey, you need to do, this exercise or that exercise. It's not a one size fits all. There's so many different variables at play. So what I'm going to do is I'm going to give you kind of a roadmap, give you some things to look at and some strategies that will help kind of get you started and get you on the road to getting this kind of fixed. Okay. So the first thing that when I was reading through this, you said that the specialist said your right sacrum is shifted posterior compared to your left. So here's the thing. The sacrum and the pelvis, the sacrum is actually kind of like a triangle-shaped bone. A lot of people call it the tailbone. It's actually part of it, but that goes between the pelvis and it's in the backside. Typically, if the sacrum is shifted posterior, the whole sacrum would be. So what I'm imagining is that you meant to say the right ilium, meaning the right side of your pelvis was shifted posterior compared to the left. That just in my mind kind of makes more sense out of it. So I'm going to go with that. So here's the thing. Now, if you have a right shifted ilium, the right leg would tend to be longer rather than shorter. So if the leg is showing that it's shorter than the right, it might suggest that there's some other issues going on. On that right side. That could be a muscle imbalance issue. It could be a true leg length discrepancy where you have one of the bones, the femur or the tibia could be shorter, actually like, you were born that way. But either way, that's just kind of what's going on in my mind about that. The other thing is it really shifted? Is the right side really shifted posterior or is the left side shifted anterior? Did they look at that left side? Is that what they came up with? These are just kind of ideas and questions that I would have in my mind. So with that being said, here's the thing. In regards to like exercise and everything like that, I've got a few strategies here and things that I want to share with you that I think will really help you out. So before we go with exercises, I know it's like you just are like probably sitting there going, just give me the damn exercises, right? Just tell me what to do. Here's the problem. When you have like significant pain and inflammation the way that you're describing, where it's feeling like a blowtorch and it's unbearable. And that's the other thing is you didn't mention which side the pain was on. Is it on your right SI or your left, or is it both? I'm not sure there. But case in point here, when there's pain and inflammation, if we just add exercise on top of that, we could do more harm than good. So the reason why is that when there's pain and inflammation going on in the body, exercise is basically a form of stress. And if we add more stress to an area that's already basically quote unquote stressed out because it's got pain and inflammation, we can make that worse. The body can go into more pain, which will drive more inflammation. And so it could just make the whole thing feel worse rather than better. So we don't want to do that. So the first thing that you want to do, or that I would suggest you do, and granted, I'm not a doctor, physical therapist, or chiropractor. So before you take my advice and go apply it and everything, be sure to get your doctor, your physical therapist, your chiropractor, get your medical professionals advice about this, let them know what you're doing, get their approval before you go and do this. I have to say that, I'm sorry. But we want to get the pain and inflammation down. We want to get it down to the point where it's at least tolerable and it's not negatively affecting your ability to have healthy, full range movement patterns. That is the first thing. Pain and inflammation affect movement, and it just messes like everything up in terms of how you're trying to move. And so that is the first area that really needs to be addressed, getting the pain and inflammation down to at least to a place where it is tolerable. Okay, so once we have that, then, you know, this number 2 can maybe be the cause of number 1, or it can be affecting number 1, but it's the correction. So if you talk about having this alignment issue where your right side is posteriorly shifted compared to your left, what we need to do is kind of figure out the best way to correct it. And if it's something that needs to be corrected. What I mean by this, and this goes the same with scoliosis. You mentioned having a left side scoliosis. Here's the thing. Most people already have some form of scoliosis going on. It is a very rare time that you would find somebody who doesn't have some degree of scoliosis going on in their body. Most of us do. It doesn't always cause pain, and it's not the end of the world. But here's the thing. Unless it's more of a significant scoliosis, if you have a severe scoliosis, then that's something else. If it's a very minor scoliosis, I wouldn't even worry about that. Same thing with the posterior rotation of the pelvis. If it's a very minor rotation, you know, that in my mind isn't something that I would consider significant or something we have to worry about correcting. Although the leg length discrepancy thing can be, again, depending on, you know, how much shorter is the right leg than the left leg. So I would look at first, do we need to correct these things? Is this something that's significant enough that we have to correct? And if so, how's the best way to correct it? What is the best method? Can we correct it with like corrective type exercises, or do we need to get something more like a manual therapy done? So being that you're seeing a chiropractor, I would tend to think that they're working on that already. I'm not sure what the issue is there. So that's kind of the thing, and this is something that, you know, you have to find out. Ask your chiropractor or therapist, or, you know, what is the best method for this? What do they recommend? Is this something that they think can be corrected over time with the right exercises? Okay. So now once we kind of get the corrective strategy in place, once we get pain and inflammation down to where it's tolerable now, and you've got, you know, you're able to move your body well enough to where, you know, you're not like inflamed and in all kind of unbearable pain. Now we can start to look at the exercise thing. So here's the thing that I would suggest if I was working with you. The overall goal would be that I would want you to perform what I call the 6 foundational movements. Because the 6 foundational movements, they are the movements that we perform every day in life, whether you're in the gym, whether you're at home, whether you're, you know, at work, whether you're playing sports. These are the movements that we need to be able to perform, because the better that we can perform these movements, the better we feel, the better we move, and the less likely we are to be dealing with, you know, nagging aches, pains, and chronic injuries that, you know, tend to plague us and not go away. So the foundational movements are squatting, hinging, lunging, pushing, pulling, and rotation, okay? So now, you know, what we want to do, though, is we want to identify what the weak links are within those movement patterns. So again, you know, a SI joint issue is not just a hip issue necessarily. It can be, you know, a whole body issue. You can get SI pain if you don't have a good, healthy push pattern. You can get SI pain if you don't have a healthy pull pattern, right? If your body doesn't do rotation well, you know, these are all things that can drive pain down to the SI joint. So we don't want to just localize it into one area and think, well, we just have to treat this one area, okay? And that's a lot of times what happens in, you know, chiropractic and physical therapy is where they look at the symptom, right? The area that's in pain, and try and address that. But a lot of times they're not identifying what's driving that symptom to happen in the first place. So that's kind of the thing. So when I talk about weak links, it's really taking those movement patterns, performing those, and assessing it for yourself and going, okay, where is the weak link here? Do I have a full ranged squat pattern? Can you squat all the way down into a deep squat and come back up? And can you do that without pain? Can you do that without significant compensation patterns happening? Same thing with a lunge. Do you have a full all the way down lunge pattern? You know, do you have a good healthy push pattern, pull pattern, rotation pattern? Like, how do these things look? That's exactly where you want to identify and address the weak links, because the weak links within those movement patterns, you could have different weak links in a push than you do in a squat, different weak links in a pull than you do in a single leg lunge type pattern. So you need to really identify where the weak links are within the pattern and start to correct those in there. But again, before we get into that, these are the two things that I would suggest need to be in place first, okay? So that is kind of the thing. The overall goal, 6 foundational movements, definitely. But before you start getting into that and doing all that stuff, you know, figure all of this stuff out first. This is kind of the critical component before we get into there. So I hope that that kind of helps, you know, give you a roadmap and some strategies and things to do to get you started. And, you know, in the meantime, let me know your progress and what you find and how things go. But I hope that that helps. And for anybody else who's dealing with SI joint problems, inflammation, pain, and wondering how to correct it, then, you know, let me know how this works for you. And if there's anything else that you need help with or you have questions about, leave it a comment in the section below, and I'll try and do a future video to help you with that. All right, so I hope that that helps. Let me know how it goes, and I will talk to you next time.